Thank you, Nick, and thank you so much, so many of you for coming today. A really great event, so thank you. I'm here because I'm convinced that relationship-based care is the heart of why general practice is the best job in the world, but we lose it at our peril. And it's this belief that prompted me to step out of my own practice, where I'd worked full-time for 23 years, and into this role where I've got the opportunity to tell everybody just why it matters so much. Strong, trusting relationships between primary care clinicians and patients will deliver improved patient experience, better outcomes, improved NHS efficiency, and crucially for our exhaustive profession, more job satisfaction. Now, you'll shortly hear from the Minister for Health and Social Services and also from health spokespeople of the opposition groups in Welsh Parliament. I don't underestimate the challenge those in power have to face when it comes to delivering a modern, sustainable health service while having competing demands on time, finances and resource. And I'd really like to thank all of today's speakers for the constructive and positive way they've engaged with me in my role as chair of RCGP Cymru Wales. Working in partnership with the Minister and with the support of Welsh Government funding, we'll later this month be formally launching the Welsh GPs at the Deep End project. And that's seeking to support my colleagues in economically disadvantaged communities to provide the whole person support that can really start the process of reducing health inequality. Now, these goals are never achieved by one organisation alone, but only by us all working together. Now, I do realise at a time when waiting lists are long and the ongoing impact of the pandemic is still being felt, whether through long COVID or where patients' care has been interrupted by coronavirus, I'm making a big ask of our Welsh NHS decision makers. The political and media focus tends to be towards speed of access, and of course this matters, but we've also got to emphasise the importance of the quality of that access. We need to explain the benefits of relationship-based care in terms of cost effectiveness so as to develop system incentives that encourage rather than obstruct it. Now, building a relationship over time fosters familiarity, empathy, a two-way sense of responsibility and trust. And this then encourages disclosure, it improves communication, it saves time, and it cultivates empowerment and compliance, and it reduces mistakes. And all of this adds up to fewer hospitalisations, lower costs, and I'm not joking, reduced mortality. And if this sounds like common sense, then that's probably because it is. Now, my key message is that relationship-based care is still possible in modern times, and I know it is because we're doing it in my own small practice with just over 5,000 patients. But I've also seen it in action in Brecon, where Julie Keeley works, in the second largest practice in Wales. We can do this with our styles of working. Relationship-based care offers substantial benefits. A study by Sandvik et al. Found that patients seeing the same GP over many years were 30% less likely to use the out-of-hours service, 30% less likely to be admitted to hospital as an emergency. And just think about how that would help with our current pressures in the emergency departments. And they're 25% less likely to die than people registered with their GP for under a year. Now, that risk of needing emergency care or dying begins to decrease once patients have seen the same GP for as little as 2 years, and it continues to fall steadily thereafter. And as we know, this strongly implies causality. Knowing and being known by your GP really is good for your health. Now, this effect may be related to the finding that patients are more likely to comply with treatment. They're more likely to follow advice or attend screening if they're familiar with their GP. It's about trust. There are also really significant benefits to GPs and practices. Continuity increases GP job satisfaction and it reduces the risk of burnout. This will help us with retention, which is such a huge problem with our workforce. The familiarity, trust and empathy fostered reduces mistakes. It makes our job easier and it makes us better at our job. I'm thinking about a recent consultation I had. I'm in surgery, palpating the abdomen of a middle-aged man. Out in the car park, his dog is barking in the back of his Land Rover, and I know that she's called Clover. But I also know he's in the middle of silage making, and he would not be in my surgery if he wasn't in an awful lot of pain. And I know his dad has coped with a stoma for the past 40 years because he had bowel cancer in his 50s. Now, a lot of that helps me with my job and do a good job. And knowing Clover's name is just a nice bit of my job. So, what are the barriers to relationship-based care? Unfortunately, there are many. As outlined in the Power of Relationships report, which is published by the RCGP, and we've emailed a link to everyone here, these include changing societal demographics, the rise in part-time working and portfolio careers, and of course, our increasingly unmanageable workloads and workforce shortages. But the greatest barrier to the relentless focus on speed of access is the relentless focus on speed of access rather than the quality of our relationships. So how can we address this? We need to foster this therapeutic relationship, and I'm thinking respect, empathy, kindness, and trust between doctor and patient. With the right environment, and that includes enough time for each patient, relationship-based care can be developed between multidisciplinary teams and patients. It doesn't have to just be one doctor, one patient. So if I'm looking after somebody who's dying, I can visit them at home on Monday, and the St David's nurse will go in on Tuesday, and the district nurse will go in on Wednesday. We all talk to each other, we communicate. The patient feels safe with all of us looking after them. So that means it still works, even if I'm out of the practice working for the RCGP on a Tuesday. So, all of this evidence is important, but critically, what support and investment is required? Relationship-based care needs to be a high priority for politicians and health leaders. We need it to be hardwired into career pathways. And that's going to need funding and support for practices in embedding ways of working that facilitate relationship-based care. And we need to accept that a meaningful consultation may well not fit into a 10-minute window. Relationship-based care should be incentivised through quality assurance and the improvement framework through QAFE. We must ensure it's fully integrated within the medical curricula and teaching. And all of this is only possible if we have enough GPs to meet rising demand. Now, I really do understand the urgency that drives policymakers to look at the numbers of patients seen and focus on the efficiency of the format of the consultation. But there is an association between poor continuity of care and poor health outcomes, and too many patients have given up on the idea of a family doctor altogether. The experience of building a trusting relationship with your doctor is simply slipping from collective memory. And if a good doctor-patient relationship is not something you've never known, why on earth would you cherish it or fight for it? And that's why today, in the heart of our Welsh democracy, I'm asking our politicians and my health sector colleagues to come together, to turn the tide, and to deliver relationship-based care for the benefit of our patients of Wales. Diolch yn fawr.